Welcome to Think Medicine. I'm Dr. B. Today we're going to be talking about why we sneeze. So a sneeze is a sudden involuntary expulsion of air from the nose and mouth, often triggered by irritation in the nasal passages. It's a common reflex that helps the body expel foreign particles and clear the airways.
The function of the respiratory system is to bring air, oxygen-rich air, through the nose and mouth, filtering and conditioning it before delivering it to the lungs, where gas exchange occurs at the alveoli, where the oxygen is exchanged for carbon dioxide, which is then expelled through the nasal passages, and oxygen is then delivered to the rest of the body.
Sneezing, coughing, and the gag reflex actually help clear the airways of irritants and prevent foreign particles from entering the lungs or the airway. The nasal cavity contains special receptors that detect airborne particles and trigger the sneeze reflex. It also filters the air that comes into the nasal cavity, trapping some of these irritants before they can reach the lungs. These irritants can cause the nasal cavity to stimulate the trigeminal nerve, which relays the signal to the brain to initiate a sneeze. Let's talk about the anatomy and physiology of the sneeze reflex. The sneeze reflex is triggered when irritants or foreign particles stimulate the sensitive nerve endings lining the nasal cavity and sinuses. This activates the trigeminal nerve, which carries the sensory information to the medulla oblongata, which is a part of the brainstem. And yes, it's the same medulla oblongata made famous from The Waterboy.
Medulla oblongata.
In the brainstem, a coordinated series of muscle contractions are triggered. First, the diaphragm contracts to draw air into the lungs. Then the abdominal, chest, and throat muscles forcefully expel that air through the nose and mouth, creating the explosive sneeze. Triggers that can cause a sneeze are airborne irritants such as pollen, dust, and other airborne particles that can stimulate these nerve endings in the nasal cavity, triggering the sneeze reflex. Sometimes sudden temperature changes, moving from a warm or cold environment, can induce the sneeze response. And as we all may have tried this before, sometimes looking at a bright light can also, or artificial lighting, can also trigger the optic nerve and lead to a sneeze reflex. The physiologic process of a sneeze is, again, we have the irritation. The irritants in the nasal cavity stimulate the trigeminal nerve. Nerve signals go to the brain stem, which begin triggering the sneeze reflex, causing the muscles to contract, the diaphragm, the accessory breathing muscles, which then expel the air forcefully from the lungs, the throat, and the trachea, and the nasal passages, clearing the airways. Interestingly, at its peak, the air velocity of a sneeze can reach speeds of up to 100 miles per hour. The peak force exerted during a sneeze is estimated around 40 pounds of pressure, and the estimated volume can be about 2.5 liters of air in a fraction of a second. This explosive expulsion of air helps clear the nasal passages and airways of irritants, but the sheer speed and force of a sneeze can also present health risks. Proper sneeze etiquette, obviously, such as covering one's mouth and nose, is important to prevent the spread of germs and diseases. So tips for managing and preventing excessive sneezing. Stay hydrated. Drinking plenty of water can help thin out mucus and reduce irritation in the nasal passages, which can trigger excessive sneezing. Use of saline sprays, which help to soothe the inflamed nasal membranes, providing relief from frequent sneezing. Avoiding triggers such as allergens outside, identify and limit exposure to common sneeze triggers, dust, pollen, strong scents, and sudden temperature changes. And sometimes some people might need medications, especially as allergy season really kicks up. Thanks for watching. If you guys like this video, be sure to like and subscribe for more medical content.